education project and growing and developing healthy relationships. And before we begin, I'd like to acknowledge that the work of these organisations takes place on the land of the Whadjuk Noongar people in Perth, and pay my respects to the elders past, present and emerging. And we have panellists and probably some participants joining us from other regions across Australia. So I'd like to extend this acknowledgement to the First Nations people from all around these lands. So tonight we're going to talk to you about what sexual health means to young people, how you can engage your young person in safe and informative discussions around sexual health, and where you can go for help when you or your young person gets stuck. So talking with your young person about sexual health can be a mixed experience, and I can speak firsthand to this as I'm recently going through it with my 9-year-old. So at times it feels really daunting and awkward, and at other times it's filled with laughter and it feels like it's bringing you closer together. So tonight we're joined by our expert panellists who are going to share their professional and personal insights into how you can create a safe and open space to talk with your young person about sexual health. So we have 4 wonderful panellists joining us tonight. We have Dr. Jackie Hendricks, who's a Senior Research Fellow at Curtin and a Project Manager of the Relationships and Sexuality Education Project at Curtin. We have Dr. Daniel Vujic, who's the CEO of WAC and an adjunct researcher with Curtin. We have Marcus Roberts, who's a counsellor for young LGBTIQA+ people living in regional WA with the Freedom Centre. And we have Amy Rendell, who is a health promotion and sexual health educator with WAC and holds a Master's in sexual and reproductive health from the University of Sydney. So the first 40 minutes or so of tonight's session is going to be a question and answer style section with our panellists. And then for the final 20 minutes, we're going to throw the questions out to you, the audience, to finish up with. So while the panellists are talking, I ask that you just all keep your microphones on mute and save your questions till that last 20 minutes. But if you can't hold on to your question and you want to type it in, you can pop it in the chat or the Q&A functionality within Teams, whatever you're most comfortable with. So also the session is being recorded. So I see most of you have your cameras off, which is fine. If you are not comfortable being recorded or you've got young people running around in the background, feel free to also turn your cameras off. Okay. All right. Well, now that housekeeping's out of the way, we'll get started. So I'll ask the panellists to each introduce themselves and talk a little bit about the work they do in relation to sexual health and young people. So Jackie, could I start with you?
Thanks, Rochelle. Thank you very much to everybody for joining us. I know it is difficult on an evening of a weekday, lots of different things happening in households, so I appreciate everyone's efforts to join the session. As Rochelle indicated, I'm based at Curtin University. I am a senior lecturer and research fellow. I've been here for about 10 years, but more generally, I've been in the sexuality education space for about 20, 25 years. I come with a background in health promotion and sexology, and I'm very interested in supporting the sexual health and wellbeing of young people. So I work a lot with young people, but probably more importantly, I really like to dive in and work with all of their support networks, so be that parents, grandparents, teachers, health providers, anyone else who might be an important person in the life of a young person. And I'm also the Vice President of the Australian Association for Adolescent Health. As Rochelle indicated, I'm Project Manager of the Relationships and Sexuality Education Project at Curtin, so our job is to build the capacity of school teachers to be delivering really comprehensive and engaging lessons. And I'm also the mum of 2 children rapidly approaching adolescence, so a 12 and a 13-year-old.
Thank you, Jackie. And Daniel?
Yes, hello, I'm Daniel. I'm the CEO of WAC, which used to be known as the WA AIDS Council. I have a doctorate in public health and began my career as a senior policy officer in the WA Department of Health. focusing in particular on relationship and sexuality education for Aboriginal young people and their families. And so I was involved in developing some resources, including one called Yarning Quiet Ways, which we can talk a little bit about later on. And then went on to run some statewide youth sexual health education programs in regional and remote Aboriginal communities. Then worked as an academic in sexual health for 5 years, and now am, as I said, CEO of WAC, which runs a number of programs which aim to increase the sexual health knowledge and knowledge about healthy and respectful relationships in the general population, including in young people. So lovely to be here, and thanks for joining us tonight.
Thank you, Daniel. Amy, would you like to introduce yourself?
Oh, thank you. Hi, everyone. So my name's Amy. I work at WAC also. I'm in the health promotion team. So do health promotion, workforce development. A lot of our work centres around working with young people. So I'm very new into the sector, so I only finished up my studies end of last year. I started working with WAC in February last year, but previously did some work experience as a volunteer on a couple of different projects across the sector, including the Levers project that WAC runs, that goes to Levers down south in Dunsborough every year and provides sexual health and AOD education, so alcohol and other drug education. Very, very passionate about working with young people. We do a lot of education in many different settings with young people, including schools, alternative education settings, youth centres, and different community events and community settings as well. So very excited to be talking to you all and to hear what the other panelists have to say as well. And hopefully we can help answer some of the questions you might have come to this evening with.
Thank you, Amy. Marcus?
Thanks, Rochelle. Hi, everyone. My name's Marcus. I'm one of the counsellors at WAC in the Freedom Youth Services for LGBTIQA+ young people. I particularly do counselling for queer youth in regional WA, either online or over the phone. I'm trained as a social worker and a teacher as well. In fact, I think my first lesson that I was required to teach in my teacher practicum was a sex ed lesson. And so I've been teaching and discussing sexual health and wellbeing with young people, both in school settings as a teacher and in counselling and youth work support as well. I'm also a parent of 2 young people, and I'd say my parenting approach would be best described as exhausted and overwhelmed. But thankfully, as we grapple from cooked dinner to packed lunch to cooked dinner to packed lunch, in amongst all of the reactive and tired and ineffective parenting, every now and then I do good parenting, and I try to pick out my greatest hits to talk about here, so it gives the appearance of some cohesive and expert approach to parenting. Also importantly is I'm also an uncle, and for a long time I was the big cousin for a group of my young sort of teenage cousins. They've all since grown up, but those years of those young people coming to me asking just how to, advice on relationships and identity and how to navigate this transition towards adulthood has informed my approach to discussing sexual wellbeing with young people as much as my professional training. In the counselling sessions, the nature of the counselling we do means that some young people will explicitly want to be talking about identity and sexuality, gender identity, navigating transition. But for many young people, that's not how they directly talk about it. And really what they just want to talk about is how they're feeling and getting support to identify their needs and communicate those needs, and then invite others to do the same, and then engage in some negotiation of boundaries that just maintains their care and respect and dignity in those relationships. So yeah, looking forward to the discussion today.
Thanks, everyone. So some really diverse experiences and perspectives between the 4 of you, from policy to education to service delivery, and throwing in some of the chaos, as you said, Marcus, of hands-on parenting. So to kick things off, could you define for me what sexual health means in relation to young people?
I might jump in and start with a very academic and technical answer, because that's the space I come from. But just, reminding people that when we're talking about health, that we're not just talking about disease prevention, we're talking about optimal health and well-being, and really, particularly in the sexual health space, trying to help young people navigate their sexuality and to be able to engage in relationships in a way that's really healthy and consensual and pleasurable and enjoyable. In the sexual health space and the education that we provide people, it's really easy to think that we're just talking about those basics of our bodies, bugs and babies, but really good education and health education in this space really dives into lots of different areas. So building the personal and social skills of that young person, making sure that they have good emotional intelligence and communication skills, that they see value in all different relationships that they might have in their lifetime, and how to engage respectfully and safely with each other, basic protective behaviours, and also the importance, particularly these days, of being critical and safe users of online spaces.
Thanks, Max. .com.au.
Thank you, Jackie. I really liked how you said there that it goes beyond bodies, bugs and babies. It's so true. It's so comprehensive. And Amy, with your education background, did you want to add anything in there?
Yeah, I think Jackie summed it up really well. And the definition we use is very much about it's holistically our well-being. When we're talking about sexual health, sexual health very much is an umbrella term. So we're not not just talking about disease, we're not just talking about dysfunction. We're talking about well-being physically, mentally, emotionally, socially. And when we talk about sexual health, we literally, when we go into workshops, we like to use an umbrella with all the different types of terms underneath it that could come within it. And it's, when we hear the term sexual health, we may automatically go to sex, sexual activity, but it is so much more than that as well. It's about our relationships with our own bodies. It's about how our bodies grow and develop. It's how we relate to other people, and building on, as Jackie was saying, as well, our relationships and what those relationships look like. And it's very much it's something that we like to emphasize, that it's something that no one is kind of devoid of sexuality or sexual health. It's something that everybody experiences in their own way, and it's something that's present from the beginning of our lives until the end of our lives. How that looks and is relevant to us is does obviously changes and evolves, and how that looks for another person is very different at the stages that may happen at. So it's something that, I guess, especially when thinking about with young people, and we're talking about particularly quite like children and younger children as well, we may not want to kind of associate the term sexual health with people that young, but we're talking about something across the lifespan, and something that is nurtured and learned even before we are engaging in formal education as well.
Thank you, Amy. Marcus, I wondered if you wanted to add anything to that with your experience from Freedom or just day-to-day life with kids.
Yeah. When we're talking about sexual health, I keep saying sexual well-being just because I'm trying to make that distinction, as this isn't just about a like physical health issue as well. This is not detached or separate from any other aspect of the human experience. This, when it comes to issues of sex, sexuality, sexual relationships, whatever it might be, it poses the same fundamental questions for our existence, which is trying to understand myself and the world and this relationship between me and the world. So any time that we're discussing sexual well-being with young people, we are having that discussion around a young person trying to figure out or make known who they are, and trying to understand both what the world is and how to navigate a space for themselves in the world. So this, because there's been so much cultural taboos around sex, it becomes treated like something else, which is why we come to this parenting forum, because we're like, well, how do I have this conversation? Or, this sense of like, oh, I've approached 10 years old, now I'm going to have this conversation about sexual health, as though we haven't been talking about it the entire lifetime of a young person. And I think in trying to navigate those conversations, it's just worth keeping in mind, like, I think before we even learn what our needs are, we have the unfortunate experience of learning that our needs don't matter. Like there's just so much messaging to us growing up of like, oh, you're just a kid, that's just a tantrum, you're just a phase. And then I think that just keeps going on throughout our lives, whether it's like, oh, you're just being over emotional or man up or whatever it is. There's all these messages that just keeps telling us that whatever you're feeling and whatever your needs are actually don't matter, and you should ignore them before you learn to identify them. And so I think, just when it comes to what is it that young people are seeking in these conversations, it's really just wanting that help to make sense of who they are, or maybe they've already made sense of it and they're just wanting to make themselves known and be understood by you. And when young people share themselves and their experiences with us, our response is really the one that says to them, this is what the world is going to be and what you can expect from the world. So if we can give that safety and dignity and respect and time and understanding, then, if they've experienced that from us, there's good reason for young people to expect that that's what they should get from other people as well.
Yeah, no, it is. It's so much about that, developing that sense of self and identity, and how we respond is so important. And that's why I think we've got such a good turnout tonight, because people want to get this right, as much as they can. Daniel, would you like to add anything to that? Otherwise, I think this next question I've got is just perfect for you.
All I was going to say is, like, I feel sexual health is kind of what you get when you put a bunch of ingredients together, and it's like a cake, and it's the stuff that we've kind of heard everyone else say. So, you put in a strong sense of, who you are and what you like and how you want to be treated. You put in, respect for others. You put in a strong understanding of your boundaries and other people's rights to their own boundaries. Put in the ability to communicate, and you put in sort of an understanding of ways to protect yourself and to protect others. And it's something that you bake over time, and it can start at a young age, and is something that we kind of keep on sort of building on over time.
Thank you. Okay, so that brings us to our next question. So how do we successfully manage the challenge of different expectations, understandings and values of various cultures within Australia?
Yeah, so I think when done right, sexual health is actually incredibly respectful of diversity. So I think sexual health education is actually never about saying there is one way and only one way of expressing ourselves sexually. It's about saying, hey, sex is part of the human experience, and you might have views about when and how and if that should happen, and that's entirely your right. And we aren't going to tell you what to think. Instead, what we're going to do is to create a safe space for you to think about what's comfortable for you and where are your boundaries. And after you've had a chance to kind of think about what you're comfortable with, we're going to kind of give you the skills to communicate those choices to others, because at the end of the day, you're in control. And so I think it's like anything else in the school system. It's about teaching kids how to think, not what to think. And that applies as much to sex education as it does to any other subject that they learn.
Thank you. Yeah. Does anyone else have anything they want to add to that?
I think I'd like to just caution people not to make assumptions that people from certain backgrounds think certain ways. I've been involved in quite a bit of research in the last couple of years investigating the attitudes and views of parents towards schools delivering really comprehensive sexuality and relationships education programs, and that's parents of both primary and secondary age children. And across the country, of all different religious denominations, cultural backgrounds, there's overwhelming support for really comprehensive school-based lessons. And I know that there is still a lot of dissent that we do hear from time to time, but these are just very vocal minority voices. And the vast majority of parents and adults who are the trusted adults in the lives of young people really want these conversations to happen. And it doesn't matter what their religious background or cultural background is. So sometimes I think we put people into boxes and just assume that perhaps because they're from a Catholic or an Islamic background, for example, that they might have more conservative viewpoints. And I don't believe that's actually what's happening on the ground. Beyond that, I think rather than looking towards the differences that we might have, I think it's really useful to just look towards all the similarities that we have as parents or trusted adults. We probably all want exactly the same thing for the young people that we're in charge of. So we want them to grow up with really great information and support. We want them to have everything that they need to be able to enjoy pleasurable and enjoyable relationships. So we probably have many more things in common than we do that might be in conflict. When it comes to being respectful of different cultural or religious backgrounds, I think it's really important that you as a parent or an adult figure in the life of a young person, feel empowered to share your values. I think that is the role that you can play, is to tell that young person what your hopes and dreams for them are, what your expectations are. The important thing is that we don't withhold information. So we do need to be providing them with the evidence and the science and the correct information. But if you want to overlay that with your own viewpoints, then I would really encourage you to do that. I think one example I often use is in the contraceptive space, because a lot of people assume that if you come from a Catholic background, you are not supportive of young people using contraception. So we do find in some school environments, in some homes, they withhold that sort of information from young people. But my belief is that we should be telling young people that pregnancy is a potential risk if you're going to engage in sexual practices with other people. And there are options out there if you want to reduce your risk of an unintended pregnancy, if you want to be able to manage your reproductive history. There's a few things available to us. And then if you want to overlay that with your own personal perspectives or cultural or religious viewpoints, in saying to that young person, even though there's a myriad of contraception options out there, my hope for you would be that you would do X, Y, Z, or as a Catholic, our expectation would be X, Y, Z. But just really important we don't withhold information, and then we also freely share our values with young people as well.
Oh, yeah, I think that's a really good rule of thumb, just making sure that the information's accurate, and then also sharing what's important to you from your cultural background or value or family background. Yeah. Marcus or Amy, do you have something you'd like to add there?
Well, that's I just appreciate Jackie's point there about not making assumptions, because I've spent most of my life working in multicultural settings as a multicultural youth and navigating these conversations with young people and their families, and it's not. I've not noticed a particular difference for any particular culture when it comes to navigating conversations around sex, sexuality, sexual health, whatever it might be. Every young person is, you get a room together of people, there'll always be a range of views within it. Those views will always be somewhat reflective of family views, somewhat different and challenging of family views. And there's not, I've not yet seen a particular mindset exist for any particular demographic of people. And I think the flip side of that is helpful, keeping that in mind, is not falling into this idea that if you are like white mainstream Australian with no religious background, that somehow that's a culture that is like so progressive and free of any taboo or shame around sex. That's just not the case at all. So, you know, all of the whatever you want to call it, conservatism or shame still exists in that cultural setting as well. I just want to add, I'm obviously, how to answer this question might differ slightly between whether we're having conversations like within a family or within a group of young people or within a school setting or whatever it might be. But in general, I think one is it's important that everybody know, like we have legal rights, and it's just important that people's legal rights are known. And so we need, whatever education we give needs to respect what people's legal rights entitle them to know and do. Like they're the choices that they're free to make, and they should be aware of what they are. We need to have the knowledge to navigate the world. So just when it comes to knowledge of just basic, whether it's biology or science or just even, you know, just navigating relationships, whatever it might be, that information needs to be known. And I think to some degree, if we can first just sort of put knowledge, you know, around how the world works, how we work, and what our legal rights are in one sort of category, then the other one is then the values that get applied to that knowledge. And that's a discussion around values that we can invite sort of separate to it, but make a bit of room for both. I encourage and would encourage others to sort of invite young people to share what their value systems are and encourage them to go have these discussions with family so that they can become aware of what their family's value systems are, because that becomes a really important aspect to understand so that they can have an idea of where their perspectives and ideas have come from around sexual health as well. So I don't, yeah, it's not something to be avoided or having to walk on eggshells. Like let's have those conversations around what the varying value systems are. And if you're in with a group of people, this question that's being asked to us, you ask it to them. You just ask, hey, we've got different ideas and values, and some of them might be cultural or religious, whatever it might come from. But how do we navigate this conversation that affords us our legal rights, but also communicates that respect for each other's belief systems? You'd be amazed at how effective young people tend to be at doing that, because the nature of young people is they tend to just hang around whoever's around. So the high school lunch, you know, lunch areas and things, young people are actually doing this a lot more than what we tend to as adults, where we seek out like-minded people who think like us, and then we sort of forget that those who think differently are just humans as well. But young people don't have that luxury. They're always in social settings that is a mix of ideas.
Yeah, I think that's so true. And yeah, like you said, talking to lots of different people, bringing up discussions around values really helps that young person really position where they are and the reasons behind those views and ideas as they form. I might jump to the next question just in the so that we keep time. So Amy, could I ask you, is there such thing as too young to start talking about sexual health?
Thanks, Rue. Yeah, so I guess is there such thing as too young talking about sexual health? If we go back to what we were talking about earlier about what sexual health actually means and what it means in relation to young people, my answer would be no. It's more a matter of what we are talking about. Obviously there are particular things to talk about relevant to developmental stages. It's not sitting down with a 2-year-old and having a conversation about exactly where babies come from and about pleasure and sex and things like that. It's more about how we introduce the topics, introduce conversations, or even just how we model certain behaviours, and even demonstrating our values or demonstrating communication skills, whatever it might be. That starts well before we may even realise. So I forgot to say before as well, I'm not a parent myself, but I am an auntie to 5 little ones. So I'm around 5 little ones under 4 quite regularly, and it's when sometimes you may be having conversations or demonstrating certain behaviours around them, may not seem as though that they may be taking this on board, but understanding how communication, modelling relationships, understanding bodies and private and public and the difference between the two, and understanding personal boundaries and setting those personal boundaries and consent around their boundaries and their personal selves. That really starts as early as possible, and that starts early whether we realise it or not. So short answer is no, there isn't too early, and it's more so I guess about meeting a young person where they're at, whether it may be developmentally or where they're comfortable talking about what might be going on for them, what their needs are as well, and whether or not we think maybe they're too young to be having this conversation with. It may be that we may have this concept of where they may be too young for, but maybe they are hitting puberty a bit earlier. Maybe maybe they may have their period earlier. We're having these conversations before these kind of experiences may happen, to be able so that they are able to understand these and navigate these kind of life stages with a little bit more ease and more confidence, and also know that they can ask you questions as well whenever they do need to.
Yeah, I think keeping that open communication is so important. And Daniel, what are your thoughts on if it's when's too young? Or
yeah, look, again, I think it's like anything else that we teach. So you don't teach a kid to read by handing them a copy of Dostoevsky, and you don't teach them how to count by sort of introducing them to advanced trigonometry. Like sexual health, like everything, is just something that we have to build sort of iteratively over time, and so we introduce it in stages based on the kids' sort of developmental level and their level of maturity. And once they understand one aspect, we build on that knowledge and use it as a foundation for teaching the next thing. And I think the point that Amy made is really sort of pertinent, that there's not kind of a magic age where suddenly they're capable of receiving information X. I've got a 13-year-old and a 10-year-old, and my 10-year-old is a fairly mature little fella, having grown up with kind of an older brother, and so he does know what sex is, and I have introduced that to him in an age-appropriate way. But if he was kind of one of his sort of more immature kind of younger little friends, like I probably would have had that conversation differently. So it's about knowing your child, and there's kind of meeting them where they're at. And yeah, the things that we kind of teach now, so I wouldn't teach my sort of year 4 the ins and outs of intercourse, but they need to know their body parts, they need to know to name them, they need to know how to set clear boundaries, they need to know how to articulate when they're feeling uncomfortable, they need to know how to assert their rights, and all of that stuff lays the foundation for discussions that we're going to have later on with them about things like coercion and consent and sexual pleasure and all of those things when they are old enough and mature enough to have that information. So yeah, it's just about talking early and talking often, which is another resource that we'll introduce you to at the end, and is a useful resource for parents to kind of have these kinds of conversations.
And Jackie or Marcus, what are your thoughts on that?
I just want to remind people, I understand that there's often a bit of nervousness in this space, that if you suddenly start introducing concepts or talking about things, that you might then encourage your young person to go off and try them. But it's the evidence is very clear that we need to speak to young people about each of these issues before they happen. So like Amy suggested, before, having conversations around puberty before that young person might be likely to menstruate is really important. So trying to be on the front foot as much as we can is actually the most beneficial and most protective thing we can do for young people. In countries where they are a little bit more open, there's less shame and embarrassment, we do find that young people actually delay the age of first sexual interaction. They are more likely to have these interactions in a respectful and healthy manner, much lower levels of violence and coercion. lower levels of STI transmission and unintended pregnancies. It's when we gatekeep and delay their conversations that we find young people get themselves into trouble. So it is really highly protective to create a home environment where you are that askable and tellable parent, where your young person appreciates that you are open and comfortable, or can be awkward, so don't have to be super comfortable about these conversations, but you are a person who's approachable and can speak about these issues, and no topic is off bounds. That's really important messaging to model, and we know that in homes that do that, it is much more protective and healthy for that child in the long term.
That's really reassuring to hear those positive outcomes for countries that are having those more open conversations. And, from my own personal experience, I feel like with my 9-year-old, he's at that stage, he's so open and he wants to know everything, and he absorbs everything I say. And I kind of feel that that's a really nice time to start having some of these conversations before he gets to the teenage years and he's like, oh, Mum, what would you know?
Yeah, take advantage
right now
of it.
I've got his ear.
Yeah. And also parents might not have a proper understanding of the actual behaviours that young people are exhibiting. So we know that the age of sexual consent is 16 and they're not supposed to be engaging in intercourse before that age. But the data tells us that many young people are engaging in sexual activity prior to the age of consent. And even if they're not engaging in sexual intercourse, they're still engaging in a whole host of intimate activities with other people. They're touching their own genitals, they're touching other people's genitals, they might be engaging in really heavy kissing sessions, for example. They can be exposed to a lot of harmful content online. So there's a lot of sexualized things that can be happening in the life of young people. And so we can't bury our head in the sand and think this is a conversation that I can hold off until just before they turn 16.
Yeah.
Can I add a bit in there, Ro, as well? I agree with everything that has been said. I think often this question around is this person too young hides the real issue, which is for us as parents, or just the adult in the young person's life, like we don't feel ready for it ourselves. Like that's actually the bigger problem, and because we, particularly when a child is like 3 or 4 or 6 or 8, it's very easy to dismiss and push away that question, and then we think, oh good, it's resolved, I didn't have to say anything. And it's not until suddenly they're in their teen years and now going out and dating and in relationships, and then parents like panic and like, oh, I've got to have this talk. And you might find by the time we get to that point, you say, oh, I'm ready for the talk. This young person has already been talking to other people for years and years and years. So if the real question is not so much about is there such a thing as too young? It's just like, do you want at all stages of a young person's life for them to know that they can talk to you about issues relating to sex and sexual well-being? And I think it's okay to be awkward about that, has been said, but just anything that's asked, just say good question. Just get in the habit of that. Just good question, and you can figure out the rest.
Yeah.
That immediate response of just like it's positive, it's welcomed. Anything else after that point you can navigate and come back to and work on, but just get in the habit of that positive, like, cool, good question, and then figure it out from there. And I know this is often, people aren't always comfortable talking about this. It's another social taboo that goes toward this when we talk about sexuality and sex. But the reality is that experience of sexual assault and sexual abuse are unfortunately so common and prominent in our society that we have to have an understanding of that being part of the context. And if young people don't have the words to tell you when somebody's breached their boundaries, they don't have the framework to be able to even recognize that their boundaries have been crossed, or what's happened and why they feel uncomfortable about it, then there's no way for them to go and ask for help or talk about it. So we can't then just rely on, oh, surely if something happened, my kid would come back and tell me and then we can talk about it. because actually if they haven't been equipped with the language and the framework to make sense of that, it actually isn't possible for them to talk about it. And even if they've picked up on, well, I've learned over the years that whenever I talk to this adult in my life about my bodies or something to do with sex or feel, how I feel, then people get uncomfortable and, scowl at me and try to, I shouldn't be thinking about that. Then like, well, look, that I'm not going to bring this up. If I got into trouble for asking that little question, like wait till they find out about this thing that I'm about trying to talk to them about. It shuts it all down. So yeah, just from the outset, anything that's asked, good question.
Yeah.
And then figure it out from there.
I like that. Keep the door open. And another one I heard recently was just to say to them, what do you think about that? Or tell me what you know about that. And that can be a really good way just to kind of benchmark where they're at and go, okay, this is what information I should give you, rather than jumping in with the big long-winded description that's totally different from what they thought they were asking about.
Yes.
Yeah.
Yes.
So on those useful tips, could you give us some advice on how to approach sexual health conversations with young people? Maybe Daniel, did you want to start this one off, or Amy, you go for it?
Daniel, welcome to.
Sure. Yeah, look, in terms of sort of my own experience, I think kind of creating spaces for young people to kind of ask questions and to sort of not admonish them for that, like what Marcus said, just kind of create safe spaces. And even if you are kind of thrown off guard, you can use humor or you can use delaying tactics until you kind of orient yourself as to how you're going to approach that particular question. But I think sort of encouraging that curiosity is really good, because in asking those questions or in using those words that are perhaps a bit sort of inappropriate or a bit cheeky, they're kind of testing the boundaries and trying to see where you're at and what your reaction is going to be and how safe a space you are to have those conversations. And I always want them as a dad to see me as a safe space to have those conversations, because I'd rather that they learn it from me than go off and learn everything that they need to know from sex about from sort of mainstream porn, which is not necessarily giving them the clearest or healthiest kind of conception as to what a relationship looks like and what a respectful relationship looks like. And so yeah, just always kind of just being conscious of your own response, creating that space for them to ask questions. And also, like, something that I've just found really useful is just kind of buying them those age appropriate kind of puberty books and just kind of saying, look, something you might want to look at, and kind of leaving it with them, and they kind of go through it in their own time. And then, when you're driving a car and you don't have to look at them in the eye because that can be confronting or uncomfortable, you can just kind of, look straight ahead and sort of say, is there anything in that book that you had any questions about? Or if you see something on television that, you think is covered in that book, sort of say, oh, is there anything that you saw in that book that gives you any thoughts about what you've just seen there? And just kind of create those spaces for them to sort of have those conversations. Just kind of keep trying as well. Like, it's going to be awkward for them. But if they kind of see that you're genuinely open to having that discussion, then when they're ready to have that with you, they're going to come to you because they know that you're open and you're available for it.
Thank you.
I'm happy to jump on from there. What I was going to say was quite similar to what Daniel spoke about. A big kind of point I like to kind of say, and I use this approach as well, my colleagues use this approach as well as educators, is if you're not sure the answer to a question, the kind of approaches on how you go about kind of handling the sticky questions, or whether it's not the right time to answer that question, or if it's maybe you're not too sure how to go about answering it. Probably the best thing to do is you can say straight up, I'm not too sure what the answer is, or maybe it's something that maybe you weren't expecting, and maybe it's a subject that maybe you feel a little bit embarrassed talking about, or maybe hold some embarrassment yourself. It's okay to say that to young people. Maybe going, oh, okay, I sometimes get a bit embarrassed myself talking about these things, and maybe it's because of your own experiences, parents talking to you about that, or your own experiences learning about it, that it was a lot of shame and embarrassment, but demonstrating that while you may feel kind of have those feelings, those kind of reservations at times, you are still wanting the best for them and wanting to get them the best information or the best support for them. If you don't know the answer to a question, that's okay. You don't need to know absolutely everything. There's so many supports and referrals out there, and that you can look at. It could be a matter of, I think that's a really good question. It could be finding out together. It could be, hey, there's actually there's a good website that has some videos that I'll be sending through afterwards that may answer the question for you. Let's go watch that together. Or these are some books actually been looking at. Would you be interested in reading one of these books? Or maybe if it's something that you feel more comfortable looking at beforehand and then talking to them about it, letting them know that, and just kind of keeping that transparency as well, and showing that you're not shutting down the conversation. And whilst it may not always be the most comfortable, and I have had this exact same conversation with my mum as an adult now about the conversations we had when I was younger. And you could tell if she was a bit embarrassed or was a bit of shame, a bit of uncertainty about approaching certain situations. But I understand now as an adult that was because of her own experiences learning about those topics. But at the time, you see some embarrassment, you see some shame, you see that it's something you're not maybe supposed to talk about, or it's not something spoken about. That kind of that ingrained kind of embarrassment sometimes can reflect on the young person, but if you're being transparent with them, they'll know that it's not something that is shameful to ask about, and you are comfortable and open to talk to about, and supportive with what questions, or willing to support what kind of questions or interests that may come up for them.
Yeah, I think like you said, sometimes learning together as well can really help keep that conversation open. Jackie or Marcus, would you like to add something to that?
I've got a few little extra ones. So I think if you haven't already kind of got the idea, this idea of one-off birds and bees discussion is, really problematic. It has to be lots of little discussions, literally hundreds and thousands over that young person's lifetime. So you're just drip feeding all the time that you are that askable and tellable, approachable parent that you are. Yeah, it might be a little bit awkward, but you are a safe person that they can come to and speak to about these things. It's not always about the specific information that you give. So yes, we might sit down and say a few different things from time to time over the course of a year, but what's actually probably going to have more impact is the behaviour that we're modelling all the time. So they'll always be looking at how you engage in relationships and your communication skills and how you deal with conflict and all of those things. So they're watching our behaviour as much as the formal lessons or information that we might be giving them. Sometimes I know as a parent, because we're so concerned about their safety, we focus on safety and we focus on telling them about all the scary things that are out there, but try and flip the script and be a little bit more positive in the information that you give them. Sex and relationships can be really fun and enjoyable things that we can do as adults. So we need to talk about that and not just focus on all of the bad things that can happen, because overall, sex and relationships are really positive experiences for most people. So yeah, try and flip it and not be so sex negative or try to use fear all the time. My other tip is that it really does take a village. So we want you as the parent to have lots of conversations. Books are fabulous because young people can drop in and out of chapters from time to time, but also making sure that if we're co-parenting, that person is on board. We have aunties, cousins, family, friends who can share the load. We want to wrap that person around with lots of support networks, and we want to connect them with those really reputable websites as well, because they might feel more comfortable in certain spaces or with certain people. So we want to give them lots of options as well. And if you haven't had these conversations already, or you're waiting to have these conversations, you're waiting for your young person to bring it up, some kids are never going to bring it up. So please, again, just try and get on the front foot and start talking about these things if you haven't already.
Thanks, Jackie.
Thanks. Yeah, I was just going to add, because I know the promo that went out for this was even something of like the conversation doesn't need to be scary and awkward, which is good. Hopefully we help with that. But also at the same time, like don't worry about being cool. Like let's be scared and awkward. Certainly when I grew up, in the 90s, early 2000s, there was this whole idea of that we talk about sex and positive sex positive, that you constantly had to be like cool and confident, know what you want and talk to it. And like absolutely hopeless advice for me, because I was not cool, I was not confident, I didn't know what I wanted, so I could barely make use of this. So like role modeling how to navigate sexual well-being as a very awkward scared and uncomfortable person who doesn't know what they're doing, what the answers are, incredibly helpful. And I think Amy's advice there was really good, that when questions are asked or issues come up, you just say good question, and then you can refer back like, hey, when I asked this question as a kid, like I had the same questions, I wanted to know the same things, but when I asked it, people like just reacted and made me feel like I was a bad person or doing something wrong for talking about it, and that made life actually really hard. And I don't want that for you. So but I might just need to give some time to just deal with my feelings that keep coming up about this, about these conversations, but also just to give time to figure out the answer, because these are important questions. So I want to give you a considered answer. So I'll get back to you, whenever the time is, because goodness knows these questions, when they do get asked, it's usually like, brushing teeth, and some kid, your child just goes, oh, Dad, what's wanking? And you're like, oh my God, just brush your teeth and put your shoes on. And at the school, you haven't got time, and but you go to work, and you maybe on your lunch break or stuck in traffic on the way home, you're like, okay, I've got to give some thought to how I answer this. So like this, just be awkward. Let's just do away. I actually think in general it's not helpful, this idea that sex is cool, and navigating sex you have to be cool. Like most of us are not, and we shouldn't leave this reserved for the cool people. The only other thing I want to, yeah, absolutely. The only other thing I wanted to add is, as Jackie was saying, this isn't about waiting for young people to come and ask questions. We want to create relationships where they know that they can come and ask us, but we want to be talking about this without them having to ask. If the questions don't arise naturally, like as Daniel had pointed out, like you just make sure there's books, and you've got access to videos and things online, like good references that they can make use of in their own time. I think it's also really helpful for us to be talking about these, like having these conversations with people in our lives, so that young people can hear those conversations. So if the young person's not asking and you want to raise something, just whether it's your partner or like you get your sibling to come around or a friend, and you just say like, hey, when you were young, like what was it like when you needed to talk about sex? Like who did you learn from? Where did you go to? What would you have liked to have known at that time that you didn't get told and learned later? Like just have those conversations with each other, which we do for all other aspects of life. Like if we can nostalgically raise, hey, remember that TV show you used to watch, or that band we used to listen to, then certainly we should be reminiscing on this experience of how we navigated conversations around sex, and just navigating sexual relationships and things as well. So I think that can be helpful. Then the young person can just go sort of sit in the corner, or even maybe in the next room if that's what they're most comfortable with, and they just listen to it. And everything that you're saying, every way that you interact in those moments, is role modeling to young people. Like this is how you engage with either conversations or the activity of sexual relationships. You ask, you let them know how you're feeling, you reflect on what you're feeling, you kind of go, oh, I don't really know this bit, I need to figure it out. You're constantly negotiating boundaries. That as long as all of that is being modeled in these conversations, you'll just be doing a world of good for young people.
I think that point about having those discussions when the young person's within earshot is probably a really great tip for when you've got a young person who doesn't want to hear what you've got to say. And they're just, it's just by osmosis, they're picking up on what they need to hear. So we have ran over because you've all had such wonderful insights to share with us. So thank you. I don't have any questions in the chat yet. We have had some sent through via email, but I'd love if anyone would like to ask any to go on the microphone. No? Okay. Well, before I get stuck into questions, if we do go over time and you do need to leave, that's totally fine. We will be circulating a document with lots of resources, but maybe if each of the panelists just want to give us their top 1 or 2 resources that parents can go and check out.
Ooh, I'll jump in and start with the easy one. Talk Soon, Talk Often is a really good resource. Something's been mentioned throughout the session today. So this is a resource. There's a book. It comes in a physical book version. I'll be sending out. So when you get to the emails, hopefully it gets sent all through for you tomorrow. There'll be a PDF of hopefully fit into the email, a PDF copy of the Talk Soon, Talk Often book, as well as the Young and Quiet Ways book. And there is also a really good website that's really quite relatively user-friendly as well to navigate through different ages and stages of young people and with development, what possible questions might come up, what is kind of relevant to them at that developmental stage, really good scenarios, how to respond to kind of stickier questions or scenarios. It's a really great kind of point of call, as a kind of first point of call if you ever have any questions or you want to know kind of specific answers for a 9-year-old or for around a particular topic. That's a really it's the way that it's laid out, and it breaks it down really well. Yeah, it's really great.
Thanks, Amy.
I'll jump in, just piggybacking off some of the other comments we made about taking advantage of lots of little conversations over time. Don't forget there will be opportunities all the time. There will be a celebrity scandal, or some sports person will do the wrong thing, or you'll sit down and watch television with your child and there'll be some sex scene or something. So there's always an opportunity to maybe have a explicit conversation around some things, or at least share your viewpoints and your thoughts. So there's always opportunities. We'll have friends and family who might be pregnant, they might separate or get new partners. There's always opportunities that you can springboard off to have these conversations. I love Talk Soon, Talk Often. In the paid space for parents, there's a fabulous book that's relatively new called Talking Sex. It's written by a sexuality educator on the East Coast, and it's geared up to really support parents to have these conversations, and it's probably reiterated a lot of the messages that we've spoken about this evening. So Vanessa Hamilton's book for parents, which I know is going to be on the resource list, is really good. And in terms of resources for young people, there are, like Daniel said, heaps of puberty and body development books out there. Kaz Cook's got some great ones. Dr. Melissa Kang and Yumi Stiles have written a suite of books in recent years. So Welcome to Puberty, Welcome to Your Boobs, Welcome to Consent, and Welcome to Sex are quite contemporary offerings for young people as well.
Yeah, I like the Amaze and Amaze Junior websites. They do animated videos for and they've color coded them, so they've all been targeted at various age stages. Look, I think, as Amy said, there's going to be resources sent around. I just really want to encourage people to make sure that they have books and resources that speak to the reality of LGBTIQA people existing. So even from very early on, there's board books, of same-sex parents and queer parents and queer characters. And I just really encourage people to make a point of ensuring that you've got diverse sexuality present in not just resources regarding sex education, but just in the media that exists in your home.
Thank you. So we have had some questions come through on the chat. So this is one from Cecily. So I've got a 9-year-old niece and I'd like to start some conversations with her, but I'd prefer to do it in a fun way. Maybe a game. Do you have any recommendations? And is it advised to keep it fun, or should I be more serious about these topics?
I think fun is really important. Like we've said, this can often be an awkward topic, and so let's just be honest and authentic. But just being careful that we're not trivializing certain issues. So particularly, perhaps not for your 9-year-old, but when people become a little bit older and we want to have those conversations around coercion and violence and things, we just need to make sure we're doing that in an age-appropriate way and we're not making light of these issues. But in general, let's be authentic and awkward and fun. I think there's some great little conversation cards. I don't know of a particular board game or anything that interactive for young people, but lots of conversation starter style activities for young people I've seen crop up in the last few years, where you can have, like Marcus said, all of those reminiscing conversations around what it was like for you as a young person can be used to springboard into a conversation around what might be on the mind of your 9-year-old niece.
Thanks, Jackie. I might do one more question and then we'll wrap up, because I'm just mindful that we have now gone over time. So have you got any tips to speak to a young person aged between 5 and 8 years old about sexual health and sex?
I will say my biggest tip for those younger age groups is making sure that they understand all the appropriate names for their body parts and can start talking about these body parts relatively openly and in a shame-free way. That's very important protective behaviour. So that's probably one of my key things for that 5 to 8-year-old age bracket. And also just understanding bodily autonomy, what's public, what's private. A lot of people like to think that consent is only a sexualized concept. Consent happens from birth. We ask people for permission to pat their dog or to post a picture of, tag them in social media posts. We're consenting to activities, and we should be consenting to activities all the time outside of sex. So modelling that in an age-appropriate way for the 5 to 8-year-old age bracket as well, showing that young person that they do have bodily autonomy, that they should be in control of their body and shouldn't be forced to do anything that makes them feel uncomfortable.
I remember getting that piece of advice from Jackie when my boys were little, and they were having a bath. He was sort of 6 or 7, and I told my little boy to, like, now it's time to, like, wash your testicles, and he looked very confused and went for his armpits. But now he knows what they are. So it's about sort of having that early and knowing that sometimes it's going to sort of be weird and awkward and mistakes are going to be made, and sometimes it's going to be hilarious. But just kind of leaning into that, because as Marcus says, there's no script for this stuff and there's no perfect way of doing it. And, it's embarrassing because society's told us that it's embarrassing. And so, we just do the best that we can.
Just building off of what Daniel said there, just with the around the embarrassment and kind of, and also what Jackie was saying as well, say, for example, using the correct terminology for body parts and around the bodily autonomy and private and public. Kind of, I guess, from my experiences, I have a 4-year-old niece, and she has every question under the sun. It's just out of this age bracket, but kind of with younger kids that they kind of may have every kind of question under the sun. And if you answer their question, so if they're asking a name of a particular body part and you answer it honestly, they're not going to think, oh my gosh, I said the word testicle, I said the word penis, I said the word vagina. Oh my gosh, that's so embarrassing. If they're not kind of taught to be embarrassed about it, that's kind of you give them the honest answer, and they go, okay, cool. They're not going to second guess it. They're not going to go, oh, unless as they get a bit older, they might start kind of thinking a bit more critically about it, or maybe certain things that they're in the playground at school that maybe people laugh about, and but even that could be a teachable moment too if they have a certain reaction. But yeah, kind of like if they're asking you a question or a certain thing comes up, just saying it, and then they'll go on with their day. That it won't really they don't know any different. Then they're kind of, okay, that's the name for that, or that's what that is. Cool, all right, sweet. I'm just going to go finish playing with my Lego. Like it's
Yeah, and I might sort of my answers sort of to both of those questions that came up. Look, if they're 5 to 8, 9 years old, that means that at school they most likely would have done the protective behaviours curriculum. So they're already used to conversations around boundaries, how to say, I like this, I don't like this, stop that. Or you can already ask them about just about that topic, like what did you learn in school, what did you think about it. That just lets them know you're another person that they can talk to or have that conversation with. They would also at school be talking about identifying the people they trust to go to and talk to. And so usually they do the hand and they name a different person on each finger and thumb. And you can just ask them who makes up your list, why, what things enabled that person to be on your list, what is it they've done that makes you can trust them. And then you can talk about is there anything I could do to let you know that I'm also someone you can trust. They might just be a helpful way of picking up a conversation that they're already having, using a language that they're already familiar with, and you're just inviting them to continue talking about it. If they've got any other questions that hasn't been covered, then they can bring it up to you. And in the sort of playground socially at that stage, whether or not this is for them themselves, but among their classmates, there would be conversations around boyfriends, girlfriends. And a lot of young people don't even know what that means. They're out role modeling, getting married and things seems to be the big thing around 6 years old at lunchtime, having the weddings are organized. But they don't actually really know what that means. So just asking the questions around, what does that mean for you? What's the difference between a friend and a boyfriend or girlfriend? How do you feel about it? Again, just enables you to pick up a conversation that they're probably already having. And yeah, look, you can certainly have fun while you're having these conversations, but I don't think the conversation itself needs to be fun. And the alternative to that isn't that it's serious. I think you just want to really go for caring. And you'll express that care by asking them and letting, do you want to have this conversation, and letting them know that you are available to have it now and at any other point in time if they want to ask. So just go for care, whatever, trust your gut, however else you would normally position yourself to communicate care to young people, just do the same when it comes to conversations around sexual well-being.
I think that's a really good point to finish on tonight. Thank you, Marcus. Yeah, lead with care. So yeah, so much spoken about. My head is spinning with all this information. Thank you so much for your insight to our wonderful panelists. And, I think by some of my key takeaways from tonight is that sexual health is so much more than just sex. Having these conversations with young people should start early. It does involve you, doing a little bit of research, getting to understand what kind of information you should be imparting to your young person, having a little bit of a look at yourself and your values and how you want to share your values around sexual health with your young person as well, and really starting those conversations early, not being afraid to instigate them, because knowing that there's lots of little conversations had over a really long period that's going to give your child the information that they need, and getting friends, family, books, videos, whatever you can involved to support you along that process, because you're not expected to be a fountain of knowledge. And ultimately, my favourite one was embrace the awkward, because it's going to be a little bit awkward. You're going to have a giggle. Your kids are going to have a giggle, but just keep that door open. So thank you, everyone.
Thank you. Thanks all the participants too for coming along.
Thank you. Side note, there will be a route to all of the resources we sent out that was spoken about today will be sent out in a document. They get it all through to you all tomorrow. With the recording, as soon as the recording's available, there'll also be an evaluation form link. If you could please complete the evaluation, we'd love to hear what your feedback is on the session, what you would like to know more of as well, what we can kind of help with in the future as well. Would really love to hear your feedback on that too. So we'll get that all out to you tomorrow.
Thank you, Amy. Bye, everyone.
Thank
Bye,
you.
Amy. Bye.
Bye.
Cool. Thank you. That was good.
Thanks so much, Marcus.
No worries. Thanks. That was fun.
Camera.
Oh, no!
Hey guys, well done.
Well done. I think there's someone still online.
Oh,
There is.
sorry.
Well done.
You two giggly
Oh my
people.
God.
Look at you.
Can I
We're
take an
working.
evaluation from both of you separately?
We're working.
Cheers.
Yes. That was really good.
That was great.
Oh my God.